Hello, my name is Shana Harrington, and I am the DPT Program Director at the University of South Carolina. Thank you for joining me to learn more about our DPT program. For those of you who are unfamiliar with Columbia, it is a really good location. The university itself is situated downtown, and it is located 2 hours from the coast and about 2 hours from the mountains. The cost of living is low, and the city is growing and is quite active. There are a lot of activities in the area, including college football, basketball, and baseball, as well as a minor league baseball team that is downtown called the Columbia Fireflies. There are also jogging and walking paths downtown and along the river, as well as numerous parks. So why U of SC DPT? The most consistent feedback we hear from our current students, as well as our graduates, is the small class size. Our cohorts are 30. And personally, as a faculty member, this is also what drew me to USC. This smaller class size truly makes the program feel like a family environment. Our curriculum provides evidence-based instruction, incorporating the best evidence to support what the profession of physical therapy provides. We offer a full cadaver dissection in the second semester of the curriculum. We feel this is another strength of our program. The DPT students here at UofSC are the ones that are actually doing the dissection. And as someone who has taught anatomy dissection during my career, this hands-on experience is invaluable. Additionally, our students' licensure scores are consistently well above the reported national average. DPT students in their second and third year have the unique opportunity to serve as an instructional assistant in a variety of courses. And this is a highly competitive opportunity in which students can be paid for 10 hours a week of their time. If students have an interest in furthering their education beyond the DPT degree, there is an opportunity to pursue a PhD here at UofSC after their graduation. So we are a fully accredited program by CAPTE, and that is the accrediting body for any physical therapy program. And UofSC is also accredited by the regional SACS accreditation, and the Arnold school in which we are housed is also accredited. So what is the role of a physical therapist? Physical therapists are healthcare providers who diagnose and treat individuals of all ages. This goes across the lifespan from birth and even to end-of-life care and death. These individuals often have medical problems or some sort of other health-related condition that limits their abilities to move and perform functional activities in their daily lives. One thing that attracted me to become a physical therapist was the variety of roles we can be employed in. These can include working at hospitals, private practices, outpatient clinics, within the home, within a home health agency, within the school system, at sports and fitness facilities, within certain work or industrial settings, as well as nursing homes. The program of study at UofSC is 3 years in duration with an August start and an August graduation date. This totals 122 graduate credit hours with 4 clinical experiences interdispersed throughout the 3 years. These clinical experiences total 40 weeks. This is a snapshot of the plan of study during the first year of our program. The didactic portion, which occurs in the fall, spring, and in the beginning of summer, is really set up to prepare students to then go on their first clinical experience in mid-June. During year 2, Once again, the didactic portion occurs in the fall, spring, and the beginning of summer, and this portion is set up to prepare the students to then go on their second clinical experience in mid-June. In the third year, the fall semester completes the didactic portion of the program. Then students progress in the spring to their third clinical experience, and then in May will start their fourth and final clinical experience. This table depicts each of the clinical experiences that are threaded throughout our program. What you see is that during the summer after their first year of the didactic work, all students will go on an 8-week orthopedic clinical experience. Because this is the first clinical experience that students have, typically the patient load will be lower with a higher supervision. During the summer of the second year, all DPT students go on an 8-week acute care clinical experience. The spring of the student's third year consists of a 12-week experience in a neurological population. The fourth and final clinical experience occurs during the summer, and this is a choice clinical. This is a great opportunity for students who are interested in some specialty PT areas, such as pediatrics, women's health, and oncology, for example, to gain valuable experience in those areas. Additionally, many students use this choice clinical to help solidify a specific area of interest they plan to pursue after graduation. It's during this final clinical where students experience a full caseload with minimal supervision. This table shows our program in the Gamecock Garnet in comparison with the national reported average according to CAPD. As you can see, we've been averaging roughly anywhere around 500, 550 applicants. This represents our most recent cohort of 535 applicants for several years now. And this is even in the face of COVID. We have not seen a dip in our applications. As I mentioned previously, our class size is 30, which is much smaller than the national average of 46. Our program is a little bit longer than most programs, but as you can see, where that comes into play is really the clinical experiences. And we feel the 40 weeks of clinical experiences really sets our students and graduates apart from many other programs because they just have additional hands-on time with patients when they graduate. One thing we are very proud of is our graduation and licensure pass rates, as you can see there at 100% when you compare it to the national average. This is a figure that depicts the cost breakdown for students, including tuition and fees. There is also a university requirement to have health insurance. So if a student is not covered by another plan, maybe a parent plan or spouse plan, they will need to enroll in the university's sponsored health insurance plan. We do get a lot of students who are from out of state, and there are steps and processes that they can follow to successfully gain in-state tuition for their second and third years. And many of our students do take advantage of that. The next several slides will be what I call a virtual tour of the facilities that we use within the program. This is an outside view of the Block PE Center. This ground level floor is where most of the DPT classrooms are housed, as well as many faculty offices. Also in this ground level is a student lounge that's just for use for the DPT students. The top picture shows the Blot entrance up close, and if you just go to the right of where you see Blot PE Center, there are stairs that lead down to an intramural field and also a side door that students will have key card access in a secured manner. And this is the main entrance our students use. The bottom left picture is what's known as PHRC, or the Public Health Research Center. There are some research labs housed in this building that we use, as well as a few other faculty offices. The bottom right is a picture of the UofSC School of Medicine. There are a few classes that our program does house over there, including the cadaver dissection, as well as the neuroscience course in the fall of their second year. Within Blatt, we primarily use 3 classrooms, one of which is depicted here as room 108. This is primarily used for lecture-based content courses, including such classes such as research proposal, evidence-based practice, and pain mechanisms and treatment. Another classroom space that we use is room 105. We often refer this as the neuro lab, and as you can see, this is because there are very large high-low plinth tables that are commonly seen in use in physical therapy settings working with the neurological population. The final classroom that we use is room 104, and we often refer to this as our manual or orthopedic lab. We do have 15 Metron high-low tables, and these are very similar to tables that you would see in outpatient orthopedic settings. Within the back of room 104, we do have a variety of smaller rooms, a few that depict typical exam rooms you might see. And there's a lot of different equipment housed back there, things such as traction, hydrocollator, and a variety of exercise balls and bands and weights that you may use with patients. So you may be wondering, what are the steps? I'm really interested in applying to your program. What do I need to have? How do I proceed? It is important for you to understand that we do have minimal program requirements. This includes at least scoring a 146 on the verbal and quantitative portions of the GRE, as well as scoring a minimum of 3.5 on the writing section. As far as GPA, we do have minimum standards of 3.0 for both all of the prerequisites combined, as well as your overall undergraduate GPA. If you were to be accepted into the program, it is important that you understand there are a couple things to consider. You need to make sure you've graduated from an accredited institution and that you've completed all the required prerequisite courses. Of importance, please note we have recently changed the deadline of our application to October 1st. So a few things to know when you're considering applying. We accept any undergraduate degree, and we encourage you to find an undergraduate major that you really like. We recommend having no more than 4 outstanding prerequisites when you are applying to the program. And applicants are notified of admission to our program roughly starting in December, and then it occurs on a rolling basis until our cohort is filled. This slide shows the prerequisite courses as well as credits that are required for applying to our program. Please notice that there are a variety of courses such as physics, chemistry, biology, human anatomy, and physiology that must include a laboratory. You may be wondering what we look at regarding our applicant pool. Here at UofSC, we are very transparent in this process. And as you can see currently, when we look at academic performance, we are looking at GPA and GRE. And then you can see under each what weight total each of the subcategories of the GPA and GRE are that we're looking at. It is important for me to let you know that currently we do not conduct interviews. So the previous slide showed you what we examine regarding academic performance, but please understand that the admissions committee also reviews other things, including observation hours, and we highly encourage at minimum 50 hours. And we really prefer that these hours come from a variety of settings. And that's because settings can vary, and even one outpatient setting can be extremely different from another. And we really want to ensure that applicants have seen the wide range of roles that physical therapists hold and make sure that they're really wanting to pursue this degree. We also require 2 letters of recommendation that the admissions committee does review, one of which needs to be from a physical therapist, and the other needs to be from someone that knows you academically. And we strongly really encourage that the faculty or professor you're asking really can give a good picture of who you are as a person. So you might be wondering where your scores within GRE and GPA lie compared to previous cohorts that we've accepted. This graph is showing you the average GRE for the past 6 incoming cohorts. And then the range for our most recent cohort, who will graduate in 2025, is between 296 and 316. So this is the combination of the verbal and quantitative scores. And then the average of this cohort was 309. When examining prerequisite GPA across the last 6 cohorts, you see all the averages reported there. And then the prerequisite GPA range for our current incoming class, which graduates in 2025, ranges from 3.3 to 4.0, with an average of 3.81. When examining the total undergraduate GPA, the class of 2025 had a range of GPA from 3.37 all the way up to a 4.0, with an average of 3.81. To summarize, as we come to a close of this presentation, I just wanted to highlight a few of the things that we think make the program here special at USC. As I mentioned at the beginning, the current students, our graduates of the program, and even our faculty feel the small class size is such a valuable highlight for our program. We also feel the curriculum is really set up for success in that the didactic proportion precedes and prepares patients to go on clinical rotations. And we strongly feel here at USC that integrating the clinical experiences throughout each year of the program is of great value and great benefit to the student. And that's opposed to some programs where they just put all of the clinical experiences at the end of the program. We do really work hard as faculty to not overload the schedule for students. We often meet to even discuss our exam schedule so that we're not having 2 or more exams on one day, because we know that can be really challenging. Another highlight is our anatomy sequence. It occurs across 2 semesters. So when you come here at USC in your fall semester, this anatomy course really introduces anatomy concepts with the use of models. And then we really feel that that prepares students in the spring semester to then go in and really get into the cadaver dissection more efficiently. We also do have some adjuncts in specific areas of specialty practice that maybe might not be on core faculty. For example, we have a pharmacist who comes in and teaches our pharmacology course. We have a physical therapist that is certified in integumentary physical therapy that comes in and teaches our integumentary course. As I mentioned previously, typically, as long as students complete the appropriate paperwork and steps in the time allotted, many of the out-of-state students will get a residency to receive that in-state tuition in their 2nd and 3rd year. 2 additional highlights I want to discuss is all students will complete an evidence-based research project. These projects are specific to a physical therapy relevant question. Students will work oftentimes in groups of 3 that they form on their own, and then they select a faculty to work with based on faculty current research interests. Many times, these research projects will result in state or national conference presentations. And we've had a variety of students do that, and we've been able to offer some travel support for them to attend and present. The DPT students here at UofSC are also involved in service learning. These are required each fall and spring during the didactic portion of the program. The service learning opportunities are specific to health-related experiences in the community, and we really feel this is an opportunity for students to apply their skills and knowledge to address a variety of real-life needs that are happening in the Columbia and surrounding region. So I'd just like to thank you for your time in listening to this presentation about the UofSC DPT program. If you have any questions, please feel free to contact me at the email above. And additionally, you can contact Jeriana, who is our lead administrative assistant.